Before entering my patient's room, I'll first gather my supplies. We're both wearing a face mask already. I have my Foley kit, syringe, CHG pad, a stat lock, a basin with soap and water, clean gloves, sterile gloves, and the clean chuck that I've already placed under my patient. I'll enter the room, knock, knock, knock. Upon entering the room, I'll perform hand hygiene for 20 seconds. Good afternoon, Mrs. Jones. My name is John Michael Lozada, and I'll be your student nurse today. Could I have you state your full name and date of birth for me? Jane Jones, March 10, 1994. Very good. It looks like that matches your armband. Okay, now Mrs. Jones, do you have any allergies specifically to iodine or latex? No? Are you experiencing any pain at the moment? No pain? Very good. Now Mrs. Jones, today we are going to be inserting a Foley catheter in you, and this is per doctor order. We're going to be inserting it into your urethra and then into your bladder, and this should allow you to release the urine that you've been retaining since you've been having some trouble passing urine lately. Now, throughout the procedure, you may feel a bit of uncomfortability, but we're going to try to make this as easy and painless as possible. Now, do you have any questions or concerns about today's procedure? No? Have you had this procedure done before? Yeah? All right, very good. I'll go ahead and place these off the table so we can clean our work area. Perform hand hygiene, don a pair of gloves. All right, I'll wipe down the tabletop for a full 30 seconds, starting now. All right, now Mrs. Jones, before we insert your Foley, it's really important that we clean your perineal area or your genital area. And we're gonna first do that with soap and water, and then we'll sterilize it with iodine dip swabs, okay? Then after we do that, we'll insert your Foley, collect a urine specimen to send to the lab, and then we'll stabilize the catheter itself to your outer thigh. All right, do you have any questions or concerns about that? No questions? Okay, very good. All right. I'm gonna allow it to dry for a full 2 minutes. While I allow it to dry, I'll close the door, close the curtain to give us some privacy. And before we start the procedure, I do have a female nursing assistant with me, accompanying me since I am a male nurse. So she'll be supervising us, okay? All right, so I'll place you in a supine position. I'll lay you flat. And let me go ahead and doff my gloves and perform hand hygiene. And the table should be dry now. 2 minutes has passed. I'll place our supplies on the table. All right. Go ahead and perform hand hygiene. Don another pair of gloves. Now, Mrs. Jones, it's time that we clean your perineal area. Is it okay if I lower your blanket and lift up your gown? Yes? Okay, thank you so much. Let me go ahead and put that. And I did place a blanket on your torso to keep you warm up there. So, is that okay for you? Yeah? Okay. Go ahead and lift up your gown. And is it okay if I externally rotate your legs? I'm just gonna bend them just a little bit. Yeah? Okay. Like that and like that. You comfortable? Yes? All right. Okay, so we're gonna start cleaning now. Grab the basin with soap and water. I'll grab the wet cloth that's already in there. And I'll wipe the outer. Outer. And the inner. All from front to back. Let's go ahead and pat it dry as well with our dry cloth. Pat, pat, pat. That's dry. Get rid of that. And we'll doff our gloves. Perform hand hygiene. Don another pair of gloves. You doing okay, Mrs. Jones? Yeah? Very good. All right, let's go ahead and prepare our sterile field now. Do that. And making sure to carefully open the sterile field. Making sure to only touch the 1-inch border or just the corners itself. Just rotate this just a bit like here. Okay. So I'll go ahead and grab the sterile gloves, set them off to the side. Let's go ahead and drop in our items here. Drop the syringe, and now we'll drop the stat lock and the skin protectant. Finally, we'll grab the alcohol swab and drop that in as well, or the CHG pad. Okay, so now that's done. Off my gloves, perform hand hygiene, and on my sterile gloves. Again, making sure to only touch within a 1-inch border. Okay, making sure now that I have my gloves on, I can go ahead and fix the fingers now. And I can fix the cuff too. Making sure to not touch my arm, only the outside of the glove. All right, okay, I have my gloves on, the cuffs are fixed. I'll pinch this in the middle, the start of that. I'm gonna make sure not to drop my hands below my waist. And let's go ahead and grab a sterile feet here, or a sterile drape. Make sure to lay it in between the patient's legs, shiny side down. Okay. All right, and now we can go ahead and lift this tray up and prepare our Foley kit. I'll place our swab sticks right here. Move this one. Okay, we can dispose of that. Let's start to prepare our Foley kit. Let's start by attaching our sterile water. Next, we will remove the drape or the sheet. Dispose of that. Place it back in there. Place this one in the lubricant. And finally, we'll go ahead and grab our specimen cup, place it to the side. All right, we're pretty much ready, Mrs. Jones. Let me go ahead and place this box in between your legs. Okay. All right, ready, Mrs. Jones? Yeah? All right, very good. Okay, we're gonna start by cleaning your perineal area. So I'm gonna spread your labia as much as I can. And we're gonna start cleaning with the iodine swabs. So one swipe outer, that's gone. All from front to back. One swipe outer, and that's gone. One swipe inner, and that's gone. Okay. All right, Mrs. Jones, are you ready? Yeah? All right, now Mrs. Jones, I'm gonna have you give me a good deep breath in. All right, and on the count of 3, I want you to blow out. Ready? 1, 2, 3, blow. All right. All right, I do see urine going out, so I'm gonna advance about 1 more inch. All right, and with my non-dominant hand, I'm gonna let go of the labia. And I'm going to inject the sterile water into the balloon. Remove the port. Dispose of that. And ever so gently, I'm going to tug until I meet resistance. All right, very good. All right, we're pretty much done, Mrs. Jones, almost. We just got to collect the urine specimen now. Let me go ahead and, with my dominant hand, I'll pinch the CHG swab from the top and scrub the hub for a full 15 seconds. So we can collect our urine specimen. Doing okay, Mrs. Jones? Yeah? All right, very good. No pain? No pain, very good. All right, I'll allow that to dry. Okay, it's dry now. I'll go ahead and grab our syringe, our urine specimen. And I'm gonna make sure that I see urine coming out. So since I see urine coming out, there's no need to pinch below the tubing or create a kink below the port itself. Okay, so I got my urine specimen. Going to carefully place the urine into bottles so it doesn't splash. And I'll place the cap on it. I'm going to label the specimen cup with the patient's name, the MRN, the date and time of collection, and send that off to the lab. All right, almost done, Mr. Jones. One more thing. We're gonna go and stabilize your catheter really quick. So push that aside. I'm going to wipe with the skin protectant here. Remove that. Grab your stat lock. Place it inside here. And paste it on your leg here. Okay. Oops. Sorry about that, Mr. Jones. Let's go and make sure that's taped all the way. Okay. Going to hang this on your bedside below the level of your bladder. Just make sure that's taped on all the way. All right, and I'm going to dispose of these. Make sure to clip on the side of the bed, right here. All right, okay, so we're pretty much done, Mr. Jones. Let me go ahead and dispose of these items. I'll remove my gloves. I'll perform hand hygiene, 20 seconds. Let me don another pair of gloves, and we'll get you more comfortable. All right, Mrs. Jones, let me go ahead and lower your gown back down. I'll fix your legs. And I'll go ahead and place your blanket back down. Okay, Mrs. Jones, I'm going to go ahead and put your bed in its lowest position. I'll put both your side rails up. I'll put your call light right next to you. And if you need anything, please don't hesitate to let me know. So I'll go ahead and doff my gloves and perform hand hygiene, and we'll go ahead and send this specimen to the lab. So upon leaving the patient's room, I'll go ahead and document the date and time of the procedure, the patient's tolerance of the procedure. She experienced no pain, the size of the catheter used, and the description and amount of urine. There was no cloudiness and no sediment, and it was clear and yellow. Thank you.